So this is our presentation that we created to kind of explain um, dementia as it relates to the circle of life and how it relates to our medicine wheel. Um, Go ahead, Karen, the next one, please. So the objectives for this PowerPoint is we'll describe the creation of the Dakota Medicine Wheel, discuss how the medicinal framework can be applied to dementia and as different aspects of dementia, and discuss how the Dakota Medicine Wheel was used in various presentations here at Spirit Lake related to dementia and other chronic diseases. The medicine wheel was developed and created by our former Senior Services Director, Vanessa Thomas. And then we had two or three elders, as well as the two that are listed here, Joseph Lawrence Sr., Kenneth Hill, also Catherine Howard, and then Loretta Hewer from the North Dakota NDSU. She also assisted, and then Dr. Bird. And the medicine wheel was created probably prior to me joining the team. But I came in probably at the tail end of it, so that's why I guess I kind of understand it. Since I do have the actually I think I was in the last phase of this when we created this. But anyway. So there are 4 elements in the medicine wheel which correlate to the circle of life. The medicine wheel starts on the top right with the color red, which represents the body and the child. The yellow color represents the mind and adolescence. Black represents emotion and adulthood. On the top left is white, which represents the spirit and the elder. Each part of the medicine wheel relates to the progression of dementia. Matter of fact, the medicine wheel can be utilized in many different chronic diseases. So if you look at the red, it says Hayaka Oyate, that's the Elk Nation. And so that's when you begin your life as a child. And then the yellow, it is the Wambadi Oyate, the Eagle Nation. And that's when you're a youth, an adolescent. Then you have the Wikias Oyate, Thunder Being, and that's your adulthood. And then it circles back to being an elder, the Tate Oyate. And so that is how we related those different elements to the medicine wheel. So in creating the medicine wheel, I do know that when our ancestors were growing up and people started to have signs of dementia or memory loss, there's no word in our language, in our Dakota language, for dementia or memory loss. So what they used to do was there is a word for it, but I can't remember exactly how it is said. But instead of saying, oh, he's got dementia or he's losing his memory, they used to say he's losing his mind. And so that's how they dealt with it back before I was even alive. And so then we took each element and put a different aspect of dementia in it, such as risk factors, prevention, signs and symptoms, diagnosis and treatment.
Okay, so we're going to start with the risk reduction. And excuse me, as we know that there are certain things that will potentially cause someone to have dementia. So when we looked at the medicine wheel, which parts of the medicine wheel would we focus on when it comes to risk reduction? So we're looking at like non-modifiable risk reductions and then of course there's modifiable, but with the non-modifiable risk reduction, we're going to start with the body, and body, it kind of equates to the child. So risk reduction for certain types of dementia can start as early as in childhood. So lifestyle habits, the modifiable risk reductions, such as, smoking, diet, and exercise are things that, those lifestyle habits can begin in childhood. Also with the mind, when we're, we're going back with the body and the mind, we would look at education, diet and exercise, just having a good diet and exercising can start at a young age. At Spirit Lake, they have what they call a special diabetes program. And in that program, they have an early intervention program for children. And they kind of focus on, proper diet, eating traditional meals. They have a community garden that they have in the summertime, and the children and adolescents, they kind of show them how to make traditional meals, the importance of eating, the importance of exercise. So there's starting in early childhood with the body. With the mind, we know that just staying mentally active can help with reducing some of the risks of dementia. It was interesting that I found a study that indicated that when you start reading to children at an early age, that can help prevent the onset of dementia later on in life. So when we're talking about staying mentally active, we'll be talking about, the playing games, what kind of activities can you do to keep your mind active? Continue to read, doing word games and puzzles will keep the mind active. On the emotional side, just staying connected with family and friends helps maintain that elder's mental health. How are the elders handling the changes in the family? How are they handling the changes in the community? Does that impact some of their emotions? Some of those emotions can lead to maybe some unhealthy behaviors. And finally, in the spiritual aspect, we want to maintain their spiritual well-being. So it's important for the elder to stay connected to the families, stay connected to the communities, some of the things that they've done in the past. Still continue to practice some of those traditional spiritual beliefs that they have in any of those rituals. So, and I will mute myself.
Just you want to go to the next slide? Yeah. Prevention. Prevention is associated with risk reductions, and by keeping your body healthy, by controlling cognitive diseases like diabetes and hypertension, it can reduce vascular dementia, and as well as exercising and stop smoking. And we talked about keeping the mind mentally active to reduce risk, along with the mind trying to prevent head injuries. Among the Native American population, we have one of the highest rates of motor vehicle accidents. This may result in traumatic brain injuries, and injuries at a young age may result in dementia illnesses later in life. In 2020, there was 176 Americans died each day from traumatic brain injury. In Native Americans, children and adults, they have the highest risks or highest rates of TBI, related hospitalizations and deaths other than other populations. And as for spiritually and emotionally, it's the same aspects associated with risk reductions. Staying connected with family, maintaining spiritual well-being, and others. Okay, signs and symptoms. As for the body, dementia can affect the loss of bodily functions and affect motor changes. As for the mind, the first sign of dementia is forgetfulness. And for emotionally, changes in personality and behavior. We discussed how difficult it is it can be on caregivers family members, and friends when the person with dementia no longer recognizes them. The disease can be hard on a person with dementia. However, it's very difficult for loved ones. Spiritually, one of the signs of dementia may be that the person has changes such as behavior, but in spiritual traditions, the foundation stays the same.
Okay, so when we're looking at the medicine wheel, when it comes to the diagnosis, we're going to look at all, for sure the body and for sure the mind. So, excuse me, before you can make a diagnosis of dementia, there should be a very thorough physical examination done, doing looking at person's medications. Are any of those medications causing interactions? Are they having some delirium from the medication? And we would want to look at some of the lab works, ruling out any different disease processes, such as a thyroid disease. So looking at their blood work for thyroid, looking at some of their electrolytes to rule out any heart disease, kidney disease, those types of things. So making sure that we're doing a very thorough examination to rule out anything besides what dementia is. I remember having a friend of mine saying, my neighbor's mom went into surgery and she came out with dementia. Like, we don't usually get dementia on the operating table. So making sure that you do a good examination, and then looking at genetics. What has there been a family history of some memory impairment? Like Iris was saying, they didn't have a word for dementia. So, going back in time and saying, did you see some changes that, potentially could have been a dementia that was not diagnosed? When we're looking at the mind for diagnosing, looking at some of those neurocognitive tests, such as the mini-cog. Iris and her team went to, I think it was out in Phoenix, that they did some training, that they'll be doing some mini-cog testing on some of the elders out at Spirit Lake. So we have different types of neurocognitive testing. Also like to do a mental health exam. Is there any evidence of depression or anxiety, which we know kind of go hand in hand sometimes? So in the emotional section, interviewing the family, interviewing the elder, interviewing the friends. Have they noticed any changes in the person's cognitive, any changes in the cognitive impairment? When did those changes start? What signs did they notice first? Was it difficulty, finishing words? Was it the anxiety? Was it the depression? Were there certain emotional changes that went on? So real important to find out, from the person, if they've noticed that there's been some changes. Also looking at any family and community members, of that elder. Spirituality, it's important to find out the elder's purpose in life. What matters most to them at this time of their life? What is their value? What are their wants and their needs at this time of their life spiritually? So, medicine wheel with treatment.
Yep.
When we talk about the treatment, we want to talk about what parts of that medicine wheel are we going to focus on. So with the body, looking at any of their other conditions that could be going on, we would want to excuse me, treat the conditions that they have. So if they do have some mobility issues, are they having difficulty in their home? Are they having some medicines that we talked about? Do they have medications that would be interfering with some of, causing some delirium? We can give certain medications for dementia, and kind of depending on where they are in the stage of the disease, when would be the best time to give that medication. Shaylin had talked about prevention. We would still want to, look at those preventative practices. So safety being one of the main things. What kind of safety issues would the elder have in their home? So doing kind of a functional assessment of their home. In the mind, even if there is still some cognitive impairment, we still want to encourage them to do puzzles and games and keeping their mind active, going out into the community like they have in the past. Did they play an instrument? Were they part of the drum corps or whatever? So any of those things that they used to do in the past, want to continue to have them still participate in that to keep their mind active. With the emotion, frequently we'll see depression that goes along with dementia, so we want to treat that depression. As the disease progresses, the person the elder might revert back to, when they were younger. So we would look at some reminiscent therapy, and we would look at pictures of their family, but not pictures of them currently, because they may not be in that part of their life. They might be going back into the crux of their life where they had younger children, and they may not recognize their spouse as being their spouse at this time. So using pictures of their family from the past. Music therapy is very important. Like I said, if they were part of any of the traditional music in their community, still bringing them to some of those events. With the spirituality, using reminiscence and still continuing to help them find their purpose. They still may have some cognitive impairment, but they still have purpose in life, and helping them with some positive coping skills if they need that. So.
Because there's so much information with dementia, we are ending the presentation by summarizing how the use of the medicine wheel can help with many of the components of dementia care. By using the medicine wheel, it can help caregivers provide care and comfort to each element of the person. As you can see, the creation of the medicine wheel correlated to the dementia has been very helpful for our team to educate the community about dementia. You are able to find the medicine wheel that's created by the members of Spirit Lake Dementia Team and the updated version of the Healthy Brain Initiative roadmap for American Indians and Alaska Native people.
And we just want to thank you for listening. And here are the members of our team that helped develop this and create our presentation, along with our medicine wheel and our Spirit Lake elders. And feel free to reach out if you have any questions.